So what is harm reduction? Is it a way to rid the world of drug abuse? B, primarily intended to avoid drug overdose deaths? C, a public health approach to mitigate the harmful consequences of drug use? Or D, primarily a treatment intervention such as medication-assisted therapies? Right. So most people chose C, that it's a public health approach to mitigate the harmful consequences of drug use. That is the best answer. Harm reduction does include efforts to help avoid drug overdose deaths, and it does include medication-assisted therapies, but that's not what the primary intention of harm reduction, as the term is that it's an overarching approach that has multiple strategies and interventions to reduce lots of harmful effects. So not just overdose, which I'm going to talk about here in just a second. So I'm going to have a few myths along the way, inserted here along the way. So myth number one is that harm reduction is just for people who use drugs. Harm reduction actually applies to many more behaviors other than drug use. Of course, I'm going to be focusing on substance use in this particular form of harm reduction, but there's actually other things that we do. They're all kind of considered public health approaches to reduce the potential harm of various things, right? So what does substance misuse cost us, the U.S.? A, billions of dollars related to crime, healthcare, and lost productivity. B, millions of dollars related to crime, healthcare, and lost productivity. C, hundreds of deaths every year. Or D, it mainly costs the individuals who are using drugs and their family members. All right, so everyone chose billions of dollars related to crime, healthcare, and lost productivity. That's the most accurate answer. Yes, it's B. It's billions of dollars. Millions, it's more than millions. And it's more than hundreds of deaths every year. It's thousands of deaths every year. And of course, we know that it does impact individuals and their families, but it certainly impacts society as well. So on that individual basis, it affects children. 1 in 5 children grow up with a parent who abuses drugs or alcohol. And in addition, abused children have a higher chance of addiction later in life. So we know there's that family connection. Loss of trust. People with addictions aren't likely to follow through on their word, even if they mean to. And this causes strain in their relationships, right? Increased stress. Those who live with a person who has an addiction tend to take on stress due to their partner, neglecting them and their responsibilities, right? It puts more on the person who is trying to take care of the family. Financial problems, whether it's financing the drugs or alcohol, losing a job due to substance use, certainly causes a big financial strain. Physical and emotional abuse. Those who misuse substances may act out against their loved ones. I believe the facts on that are that of the people who use, there isn't necessarily higher rates of abuse. It's that those who do experience domestic abuse are more likely to have alcohol or drugs involved, if that makes sense. And then fear and confusion, right? So the person who's using may be unpredictable. And we know when you think about like families, right, that families may unintentionally enable or cover up, kind of walk on eggshells, right? Kind of live in that fear, right, of what's going to happen. We don't know what's going to happen with that person. And so that's that individual and close, loved ones cost. So when we think about society in the bigger picture, the United States has the highest drug-related death rate in the world. And that isn't just meaning overdose, it's any kind of, drug related. So that could be variety of things included in that. But even when they look at, I assume when they say North America that they're looking at us with Canada. So we're still higher than that. And then the next high, but they are the next highest. And then Oceania, which is like New Zealand and Australia, have the next highest. So that's kind of interesting. And even Western and Central Europe, where they have some of the most lenient laws and expectations around drug use, they have one of the lowest rates of death. And then when we talk, of course, the opioid, we'll talk a little bit more about that later, but yeah, opioid epidemic has continued to escalate. So in most people, the overdose deaths are related to the medications as opposed to heroin, although it's included in there. And so it has greatly climbed. And when you think on top of the COVID pandemic, rates really escalated actually during COVID. I wasn't able to find my numbers. I apologize. I couldn't find the statistics for my area, but a colleague, friend of mine, was a social worker in an ER here in Southeast Louisiana. And she had statistics from our coroner's office that showed that before and during the pandemic, comparing before and then during the pandemic, the overdose, so not necessarily death, but overdoses seen in the ER had tripled. It was incredible how much it had been. And also on this particular graph, we can see that even between, so males is kind of that yellow on top, and then the females is sort of the orange underneath, that although there wasn't a much higher incidence among males, that gap has widened. So that's another interesting trend that's happening. And then in terms of overdose death rate, drug-related death rates, in the United States, when you look at by state, so the darker the color, the higher their rate. So this is per capita, so per 100,000 people population. So the rate in West Virginia, Washington, D.C., and Tennessee are the top three highest. My state, Louisiana, is fifth. The states with the lowest rates are South Dakota, Nebraska, and Iowa. So that was kind of interesting. And then lastly, just kind of thinking about this overall cost of addiction. So when I mentioned the numbers, I found a study that looked at emergency departments and inpatient settings. And I think inpatient, they're referring to hospital or rehab, not addiction settings. But the cost of treating misuse of whatever of substances cost $13 billion in 2017. So that was one particular study. Overall, though, when you look at, this is highlights from the Surgeon General's report from 2019, that was the most recent one I could find, and that they even separated out that it's $249 billion related to alcohol use and $193 billion for illicit drug use. So it kind of makes sense that, more people have access to and can use alcohol. It's just more widely used and available than illicit drugs are. But even, looking at that, that's still a pretty heavy cost. And that cost is related to crime, healthcare, and lost productivity. So, crime related to the cost, related to incarceration, legal fees, tying up the court system, and then, excuse me, healthcare costs, from accidents and overdoses, illnesses associated with the substance use, and then lost productivity. So someone who is not working, or maybe even incarcerated, that there is a loss of productivity in terms of the workforce and in terms of, taxes and that kind of thing. So there's financial costs. So that's just the financial costs, right? When we think about the overdoses, so overall, again, these are the latest numbers I could find, that overdose deaths doubled from 2010 to 2016. And so I put a star there that, that doesn't even count going into the pandemic, right? COVID pandemic. So they have continued to these deaths, and that's just related to opioids, of all prescriptions. So that could include other kinds, not just opiate prescriptions, but all possible prescriptions that could contribute to death. There were 47,000 people that died in 2014. So that brings an even higher number. And that alcohol misuse is attributed to 88,000 deaths a year. So that's, again, even higher, right?